We're jinxed now.
Hello everybody and welcome Annette, and who's in the room here with me, socially distanced, and Natasha for our office in Kells, and Ruth in her office here in Castlebar. Ruth and Annette, thanks for joining us to talk about your experience of talking about the change you've been involved in and how the guide has, I suppose, supported or enabled you in some of that work. And this is, I suppose, and Natasha, you showed it there earlier, I'm just showing it here again. This is the book, it's the booklet on the change guide that Ruth and Annette used to support their work. Okay, so without further ado, I'm going to hand over to Annette and Ruth to introduce themselves, and I will disappear off the screen, but I'm here in the room with Annette, so you'll hear me talking in the background. So Annette, with yourself.
Thank you, Marie, and good afternoon, everybody. My name is Annette Cuddy. I'm the director of the Centre of Nursing Midwifery Education in Roscommon, and together with my colleague here, Ruth, we have been involved as project officers in the implementation of peer group clinical supervision for nurses and midwives across HSE West and Midwest since 2018. Ruth.
Good afternoon, everybody. My name is Ruth Hoban. I'm delighted to be here this afternoon to share our journey in relation to the implementation of peer group clinical supervision for nurses and midwives in HSE West, Midwest. I'm currently working as an Assistant Director of Nursing and Midwifery for nurse prescribing in HSE West.
So Annette, maybe you could just tell us a little bit of the context of the change project that you were involved in.
Yeah, sure, Marie, no problem. So what happened was in 2018, the then director of the Nursing and Midwifery Planning and Development Unit for HSE West and Midwest was approached by a number of senior nurse and midwife managers and asked to consider looking at how we might implement clinical supervision for nurses and midwives. And really the reason for that was that then as now there was an issue with recruitment and retention, and it was to encourage people both to come and work in the area and to stay in the area once they came working. Coincidentally to that, the Nursing and Midwifery Planning and Development Unit in the Northeast published a 3-year framework for how they were going to implement peer group clinical supervision, and also HSE South, the Nursing and Midwifery Planning and Development Unit in the South, were also involved in a similar initiative. So really we took those two as our guide and we liaised with people in those areas, and also taking into account the change guide here, and we proceed on that line. We adapted really to suit HSE West and Midwest and the context here, and nurses and midwives here.
And so then, ladies, if I was to ask you, how did the guide, I suppose, support you in your work? Ruth, do you want to maybe share your insights?
Yeah. I suppose you just see there on the screen in relation to the elements, the define, the decide, or design and deliver, those 3 phases. I suppose they in so important that the stakeholders that were going to be involved in this initiative, that they were very, very clear in relation to what clinical supervision was and was not. As we all know, people are very familiar with managerial supervision, and sometimes it gets confused or mixed up with clinical supervision. So we needed to let people know that clinical supervision is seen as a mechanism for providing positive working environments that offers support to staff, nurtures empowerment, and helps build resilience and encourages quality and safe standards of care for patients. So we needed to ensure that the people that were going to be involved in the change initiative were very clear in relation to what the aim, what the objectives of the change initiative were. We were going to need their buy-in from the get-go, and we were going to need their support, their ongoing support throughout the all the phases of the initiative, the define, the design and the deliver.
And Annette, I know you mentioned to me before that you needed to have really high-level sponsorship for this particular change initiative.
Yeah, so it had to be a top-down approach, Marie. It had to be supported by Directors of Nursing Midwifery. And the reason for that is that the nurse and midwives that become peer group clinical supervisors have to be released first to do their education program, and secondly to facilitate and supervise the groups of peers that they are going to supervise. So for that reason, the buy-in from and the support of senior nurse and midwifery managers was essential for that. So one of the first things we did was we set up 2 steering groups, one for HSE West, Mayo, Roscommon and Galway, and one for HSE Midwest, Limerick, Clare and North Tipperary. And I think that was one of the critical success factors of this initiative. Myself and Ruth are project officers to those steering groups, and I suppose one of the, again, another critical success factor is communication. I know Ruth has already mentioned this, relentless communication, where you inform the steering group at all times where we're at in the initiative, and also you inform the new clinical supervisors and their supervisees. So it's just to keep that 360-degree communication going at all times. I think that's really important, but the top-down approach to us was the most significant factor here.
So really, if I was to bring it back to the guide, kind of from what you're describing to me, is you're creating those conditions for change in the defined stage. So you're having that shared vision, that shared purpose, that collective leadership piece and the buy-in. You were leveraging what was in the system and who could move things for you. You were building the team as you went along.
Yeah. I think that is true to say, Ruth, that we recognized very early that as I said, top down was the most important, and also the support from the Nursing Midwifery Planning and Development Unit director was very important as well. There is a financial element to this as well, and that people have to be released, so that had to be supported as well.
So if I was to ask you for the nurse and midwife, what does it mean? What does this project mean? What does this change mean? Ruth, would you like to answer that?
Yeah, I suppose it really encourages staff to think critically about their emotional and their professional response to their practice, and to examine ways of improving their practice, and also to celebrate what they're doing well. And all of that then contributes to a patient safety culture. And I suppose in relation to the design phase of the project, we got off to a great start. However, then in 2020, COVID hit. And as you can appreciate, clinical supervision was not high on the agenda for services. So we had to go back to the design phase. Clinical supervision is best delivered in a room, a safe, private, confidential space. Face-to-face, that couldn't happen. So back to the design phase, how are we going to still deliver peer group clinical supervision? So at that stage, most of us had moved to online platforms. So the Zoom, the WebEx, the Microsoft Teams, and also even teleconference. And that was both to deliver the peer group clinical supervision groups, but also for the peer group clinical supervisors to access their external supervision, which they were getting every month as well. So we had to re-engage with services. We had to listen to what the real issues were on the ground. And we all know what people had to work through and with last year. So that compassion piece was very, very important. Of course, Annette and I wanted this to be a success. Of course, we wanted to build capacity and sustainability, but we also had to be mindful of what was going on in the services at the time. So we had to look at that design phase. We had to look at a pause or an interruption in relation to peer group clinical supervision. But we as the project officers also very strongly to try and keep communicating, keep re-engaging and being supportive, continue to build momentum even in times when everybody was struggling and challenged.
And so, ladies, and I suppose I'll direct this to you, Annette. How did that, I suppose, affect you? How did you keep your momentum going?
I suppose myself and Ruth are passionate about clinical supervision. As when we talk to people about it, this is reflective practice with your peers in a very safe environment, as Ruth so well explained there. So the two things I would say is it is something that we're passionate about. We can see the benefits of it. We were talking to Natasha earlier, and we know that our social care colleagues will get their clinical supervision really generally when they need it. So they'll say, I cannot do that at the moment because I'm getting my clinical supervision. The vision that Ruth and I have for this is that nurses and midwives will come to that point that I cannot do that at the moment because I need my clinical supervision. That's really what we're trying to do. We're trying to build capacity, build traction for this, and to really get it embedded in HSE West and Midwest. I suppose in terms of delivery, we have to support this. We have developed a suite of documents. We have a guidance document to support the implementation. If you want to hold it up there, Ruth, and we also have supporting toolkits. So what we want is people not to have to develop their own contracts, their own record keeping documentation. So that's all incorporated in the toolkit. So how do you become a clinical supervisor and how do you implement this in your services? All incorporated in that guide.
And I suppose my final question to both of you is, you know, how is this being mainstreamed?
So the initiative was set up initially for 3 years. There are terms of reference for the steering groups, and that has been very clear. Because of COVID and the impact that Ruth described there, the steering groups have agreed to expand by another 2 years. So we would envisage that over time that we would become less involved and that the service will go on and become more self-sufficient in the implementation of this. And also as more and more people become clinical supervisors, that traction will be there and it will have built capacity.
So it's really moving from the coordination to the co-production to the co-delivery piece, isn't it? Yeah, really good, really good. So ladies, any nugget of personal insight maybe in managing change that's important for people embarking on change?
I suppose for me, and something I think myself and Annette are very proud of, is the ongoing support for both the stakeholders, the managers, but also in relation to the new peer group clinical supervisors. We have asked them a big ask, and particularly when COVID came, to continue with the delivery of peer group clinical supervision to their peers. And I think it is so important that we have that ongoing support. We had a very open door policy in relation to any queries, in relation to the facilitation of peer group clinical supervision. But as Annette says, we also want to empower the services, and we want to empower our new peer group clinical supervisors that they can do this on their own. And I suppose it's about changing the culture within nursing and midwifery in relation to peer group clinical supervision, that it becomes part of their working month, that they get 1 hour of clinical supervision while at work. And that is Annette and ours dream, that it becomes part and parcel, embedded in the everyday working life of a nurse and a midwife in this country. And I know we're looking at HSE West and Midwest, the initiative, but we would like to see that there would be a standardized approach to the delivery and facilitation of peer group clinical supervision, that every nurse and midwife in this country could avail of it. I suppose clinical supervision is not mandatory in relation to nursing and midwifery, it may be in other disciplines, but we want to have and allow every nurse and midwife to have the opportunity to avail of it. And as Annette says, we are committed to that. However, we do need to empower the services, and we do need to continue to empower our peer group clinical supervisors.
Very good. And Annette?
I suppose just to reiterate what Ruth said is exactly stop recording, I've lost my thread.